Good evening, all.
Good evening.
Hi, Tim.
Hi, Mr. Myatt.
Hey everyone, welcome. I'm sorry I'm a hot minute late. Looks like we have a good number of people here. Just gonna admit these last minute people. So with everyone just gathering, before we start, I want to let you guys know that I'm going to suspend Robert's rules for this meeting. A lot of things came up last minute. COVID is kind of changing our environment every minute, and so there are some more pressing issues, and we also have some guests, Amy Chacha and Matt Clifford, who are joining us to kind of help answer some constituent concerns. So with that, I'll be suspending the rules. If at any point anyone would like to return to the orders of the day, you can make a motion to do so. If you need clarification on how to do that, you can message Vivian, or you can interrupt with a parliamentary inquiry. But with that, the only thing we're going to do before we just kind of move into dealing with constituent concerns and COVID-specific concerns is approve the previous minutes. Does anyone have objections to the previous minutes? Any objections? Okay, we'll approve the minutes as written. And then we will move on. Miles wanted to give a little bit of a statement before we move on to the next portion. So Miles, you can go ahead.
Yeah, absolutely. Thank you, Allie. I just wanted to say to you all, just breathe for a second. I told Cabinet that Sunday, but most importantly, just breathe. I know it's probably a lot for you all, especially as students, but just remember you all are students first, and senators second. So please prioritize yourselves, especially during this time period. I don't want you all to feel stressed at all, so I prioritize your mental health, of course. And most importantly, I would just say that you don't need the answer to everything, especially when students come to your concerns, come to ask you about concerns on their end. You can always ask us, from the exec to Tim and all the people present today. Just make sure that you all don't give out information that probably can be misleading. And we just want to make sure that we're doing the best we can to give you all the best information back when you ask us questions. And then most importantly, as I said, take time for yourself. Allie did a great job last night of fielding the questions. Personally, from my end, I had to deal with some family stuff. So I thank Allie for dealing with all that stuff last night. And most importantly, that's on the side of all of our exec members who are trying to do the best, and cabinet members who are trying to do their best also in regards to getting questions, fielding concerns, and answering them. But lastly, I would just say that patience and calm leadership is probably needed right now. Don't feel in a rush to do anything. So just be calm, be patient, especially with administration, especially with their process and what they're trying to do and trying to make our campus safe for all of our students. So I just want you all to know that while administration is working very hard to get the things moving in the right direction, so just remember the short run might be bad for right now, but the long run will come out better. So don't look too much into things, and just make sure that you all are just being patient and calm on that end. We'll make sure to give you that information that you all need for your constituents. But I just thank you all for getting all that information to us and making us have the ability to get these answers solved and whatnot throughout for our community. So thank you. And now I'll just pass it off back to Allie, so that we can get Dean Clifford and Ms. Joshua back into the room.
Thank you, Miles. And I just echo everything Miles has said. Y'all are doing great, and remember to take a break if you need to. There's a lot going on right now. So I'm going to hand off the floor to Matt Clifford, the Dean of Residence Life and Housing, in case he wants to say anything introductory. And I would also say if Amy Chacha or Tim, you want to add anything at this point, feel free. And then we have some constituent concerns that were submitted to us by members of the Wake Forest community that we will kind of run through, and then we'll have space for other senators to offer concerns or ask questions as needed. So Matt Clifford, I hand off to you.
Thanks, Allie. Happy to respond to questions. That's probably going to be the most instructive thing, but certainly I appreciate Miles's opening in terms of taking a little bit of time to breathe. I on occasion will do the same for the start of my staff meetings. It just helps to ground yourself and be cognizant of your surroundings. Certainly, we're all navigating a tremendously fast-paced environment where things are quite fluid and the circumstances are changing rapidly. We are always trying to keep the public health frame, at the forefront, and that to continue to let that guide us. And so we feel confident about being able to get through the other side of this particular surge, and to get back to at least previous conditions, if not better. And I feel really confident in our ability to do that, but it's challenging right now, that's for sure. So in terms of we are working on some updates that'll hopefully come out this evening about our quarantine and isolation protocols, and I think there's probably many of you have questions about that particularly. Right now we're managing it's certainly in the middle of a surge. We are experiencing a strain on systems, especially certainly contact tracing and our quarantine and isolation systems. So we've implemented some measures, including quarantining in place to preserve hotel space for students in isolation. That's students who are symptomatic or have tested positive for COVID-19. And in some cases, we're asking for students who are both symptomatic and have tested positive to share a hotel room. I do want to share that we have secured additional hotel space, and it's going to be available very soon. So we're excited about that. And that's a very new development as of today. In terms of the quarantine in place aspect, because we need to preserve those spaces for hotel spaces for students who have symptoms or have tested positive, we are asking students who've been exposed to someone who tested positive, but who are not exhibiting symptoms themselves, to quarantine in place in their own living space if they have a single room. If they don't have a single room, we're looking at our processes right now. Right now, we're moving our student who needs to be who's exposed. We're relocating that student to a totally vacant room. Certainly, in some circumstances, that vacant room is on and it's in a suite or shared space with other students, and we're cognizant of the impacts that can have in the living environment. However, the practice of having students quarantining in their rooms was reviewed closely. We developed these plans actually this past summer and reviewed those really closely with our medical advisors and CDC guidelines. Sharing a bathroom with someone in quarantine is not a high risk as long as students practice what we've been asking everyone to practice all year long: wearing a mask, staying 6 feet apart in those spaces, and certainly washing your hands thoroughly. And so it's actually a practice that we've been implementing with off-campus students last semester and found it to be very effective. But that being said, we're going to certainly continue to evaluate our practices and are, again, in the midst of evaluating them really as we speak. So I wanted to just say a few of those things at the outset, and happy to, take questions, or I don't know what the next steps would be for y'all's business.
Yeah, absolutely. So we received a number of general questions to our constituent concern form that were pretty related to either quarantine or res life. Braden has kind of Braden is our speaker pro tempore and academic co-chair. He has consolidated those specific concerns into one general concern that he can voice for you now. And then we'll open up to other questions or concerns from the Senate as a whole. So Braden, you can go ahead.
Yeah, so as Ellie is saying, we've received numerous concerns from people around campus, those that have been quarantined in other dorms than their own, and those that have been affected by other people coming in to dorms other than their own, and members of student government themselves. They feel the university is putting the people in the dorm that contact trace people are moving to at risk. And quite frankly, a lot of the scenarios that we've been hearing do not make sense. We've had entire suites and like quad dorms contact traced and then moved to communal style bathroom dorms on South Campus. And to all of us, that does not sound like it makes a lot of sense at all. And we've heard numerous instances of this, people moving to apartment style dorms and such. Yes, so no one seems to understand this process and how it's at all effective or even safe for people around campus.
So with those general concerns, I guess, more so than questions, would you have any information, Dean Clifford, about future communications about potential change to the policy, or how the decisions about moving people are made currently, so that people might have a little bit more clarity on the situation?
Sure, I can talk a little bit. Excuse me. I can talk a little bit. And Braden, I understand it's very complex, and so I can talk a little bit of how we make those decisions. So right now, since we are preserving hotel space for students who need to be isolated, again, that's students who've tested positive and or have symptoms for the hotels, then we are quarantining on campus more. And again, those are students, quarantine students have had exposure to someone who's tested positive, but who are not experiencing symptoms right now. And so what we need to do is try to, again, move them to a private room. That's the most critical aspect. And so what we do is we receive information from contact tracers about a student who might need to be placed in quarantine. And we evaluate the student's living environment. And if they're in a single room, then well, more often than not, it's pretty simple to allow them to quarantine in place. There are a couple other situations that might allow them to quarantine in place as well. But if they share a double room, then in that situation, we need to relocate a student. And right now, again, we're navigating through a process to move the exposed student elsewhere. Again, sometimes that is always to a completely vacant room. Sometimes you're right; it is in a community that, perhaps a community on South Campus where there's a shared bathroom. Again, our public health folks believe strongly that there's a very low risk for transmission for a quarantine student who's not experiencing symptoms to another student in shared spaces, if that student, again, in the restroom especially, if all students are wearing masks, social distancing, maintaining 6 feet of distance, and washing their hands thoroughly. Quarantine students are not allowed to leave their rooms except to use the restroom or for a life-threatening emergency, essentially. So because of that, we feel that those measures are sufficient to keep people safe. But that just that hopefully explains a little bit of how we navigate those decisions.
And this might be a question for you, Dean Clifford, and it might be a question for Tim or Ms. Chacha. But we had a question come in about why people are being asked to quarantine for 14 days while the CDC is recommending 10 days. My impression of that is that 10 days is for those who have a positive test or symptoms, and 14 days is for people who have been contact traced but don't have symptoms or a positive test. Is that correct? And can someone expand on that?
Can you repeat the question? I'm sorry.
So why is the Wake Forest policy 2 weeks for quarantining when the CDC is recommending 10 days?
The CDC is really still recommending that 14-day period. That is the sort of highest level. They did make some adjustments to their quarantine policies to allow for a 10-day release. And we, again, if that comes with testing, it comes with symptom monitoring. It actually comes with symptom monitoring for the 11th to 14th days, that the student still needs to monitor their symptoms for that period. But the CDC certainly did make some adjustments to that, in part because it was so quarantining is very challenging. But the 14-day period is still seen as the real high standard, and certainly we want to be able to uphold those high standards if we're able to, and if conditions allow us to do that. But there is a a 10-day quarantine option that comes with some specific rules about testing and such. And we are, if we're able to, again, if capacity allows us to do that, then that's what we're following.
Thank you. I believe those are the questions that we received from constituents about residence life and quarantining specifically. So if any senators have questions or concerns, I would invite you to please use the raise hand function. I will call on you. Please limit your comments to about 30 seconds if possible, and remember to be respectful. And remember that this is recorded. So Ethan, I saw your hand first.
Yeah, thank you, Ali. We had 2 questions I'd received from constituents, basically around the same thing, consequences and enforcement mechanisms. One constituent was wondering more specifically about the consequences for those engaging in risky behaviors during this time. And another constituent was wondering about the specific enforcement mechanisms in place to deter those who have been contact traced and living in residence halls from engaging in risky behaviors as well. So any answers to that would be great. Thank you.
Sure. We have, you all know, we have our public health addendum to the code of conduct. We also have, as we talked about last week, our COVID amnesty protocol. I would tell you that we're working through things as we would standard conduct cases, in terms of as information comes in, whether it's through COVID reporting, whether it's through an email, anything that comes into the university, we look into things proactively. As you all know, if you send me something, I will send it along, as well as reach out to the chief of police, for example, if it's something that hasn't occurred yet. So Dean Settle, and right now Dean Settle has an expanded conduct staff to help make sure we're monitoring or moving through the caseload as quickly as we can. I would say the biggest challenge we have, and I'm going to co-opt the question a little bit and jump into organizational conduct as well and I'll name fraternities and sororities, but they're not the only organizations, as well as individuals. So much of it is the information itself. Is it something tangible that we can move forward with versus is it, hey, I saw this group. We follow up on everything. We've suspended some organizations. We have other organizations under investigation. We've spoken with every organization. The president met with every organization. We met with every fraternity over the last 2 days. And Betsy Adams is meeting with every fraternity president and new member educator over the next few days. Where we have verifiable evidence, we move forward with conduct action and investigations. Where we don't, we continue to engage chapters because we want to be proactive and then we want them to know that information's coming in about them. And also people have asked, why are we allowing groups to continue to move forward with activities? All activities are supposed to be virtual, just like student organization activities. Again, if we find out otherwise, we will move quickly with the information we can to handle that. So that's kind of how we're dealing with both individual conduct as well as organizational conduct.
Thank you, Tim. Does anyone who has their hand raised, if you don't have a question about Res Life specifically, I'm going to ask you to put your hand down for this portion just because we have a limited time with Matt Clifford.
Apologies all, I did not mean to co-opt Dean Clifford.
No, you're so good. I wasn't as clear. So I'm going to ask CJ, your hand I think was up first.
Yeah, so I mean, just in I don't know about the whole dorm. I'm in Huffman. We have 4 rooms sealed off here. It's just more of a sense of students, have been coming up to me, don't feel comfortable with it. It's just a strange environment to be living in, and we've seen some of these guys going back and forth in the bathrooms, and they seem frustrated too that they can't just stay in their rooms. So I'm just wondering what the thinking was behind, if these students have been around people who have tested positive, and these positive people have been sent to the hotels, what's stopping these students from just quarantining in their own rooms? Why are we just, I just feel like we're inviting future conflict or negative health impacts by spreading contact trace people around campus.
Yeah, that's a great question. We would only move a exposed student. Again, it's an exposed student who's not experiencing any symptoms to out of their room to another vacant room on campus if as we're evaluating essentially their current living environment. And really, again, especially if they're in a double room. So if they're in a double room and have a roommate, they can't quarantine in place because they could be exposing their roommate who they share a very close environment with. In a situation where we relocate them to a vacant room and give those students very clear instructions about, again, they're instructed to, I know it's challenging, it really is, to stay in their room. We deliver meals to their door. We deliver, we provide laundry bags for them, and we'll launder their clothes for them because they can't use the community laundry rooms. And again, we obviously know they will need to use the restroom, but they're instructed to only use that briefly and to wash their hands before and after they return. So that, given those really narrow set of instructions, we feel, again, and our public health experts have reviewed these plans really thoroughly, that is, certainly meets those CDC guidelines and is a very low risk to the community. Whereas to leave them in their room with their roommate is a much higher risk to the roommate who is not exposed.
Thank you, Dean Clifford. I'm going to ask that anyone who doesn't currently have their hand raised does not raise their hand at this portion. If you have another question that is related to Res Life, you can either send it in the chat or we can try to address it later. Brooke, and then Dave, and then Tim, and then Kate.
Yeah, so my question is, and I know you talked about how you wouldn't move a student unless it was absolutely necessary under certain circumstances, and that the medical experts have said that there is that low risk of transmission, but how is it fair to the students who live on those halls who aren't going to the parties, they're wearing their masks, they're only going to class? How is that fair for them if they end up getting COVID because someone who did break those rules are now living on their hall and sharing a bathroom?
Yeah, I appreciate that sentiment. And again, these are students who I don't know necessarily that they were, again, whether it was a rule breaking piece. So I want to maybe shift away from the conduct aspect and really think again about the risk that's put into a congregate living situation with a student who is quarantining, and really try to help remind everybody about the practices that we can take and be responsible for, and should be taking all the time. And if we practice those, we are very safe, even in a situation where there's someone quarantining on our halls. That if we're wearing a mask in the residential space, which certainly we should be, if we're wearing a mask at all times when on campus, if we're practicing that 6 feet of distance, and if we're practicing good hand hygiene, those are really safe practices that will greatly reduce risk regardless of the situation. And even if there is someone quarantining on your floor, I know that it might not seem fair, and certainly once we are able to emerge on the other side of this surge, we will certainly go back to our previous protocols, because that's the best way for us to protect our community right now. Again, because we have reduced capacity at the hotels, we need to prioritize the hotels for our students in isolation. But again, being able to practice those is really, really critical, and I think protects you really well even in a residential environment.
Dave, and then Tim, and then Kate.
Yeah, so I just heard from a constituent that today he's in quarantine and isolate. Well, he's not in quarantine. He's in isolation from being exposed in Huffman, and he never got his meal from the meal delivery service or whatever. So he called, I don't know if it was Dining or Res Life or whoever it was. They told him to walk on campus to go get his meal for himself. he didn't tell me who exactly he called. I can get in contact with him again and let you know. But somebody told him to walk on campus masked to go pick up his meal, and I just thought that was very not good to tell a student in isolation to go pick up their meal.
Yeah, that should not be the case. Absolutely not. But I want to emphasize again, we don't have any students in isolation on campus right now. I shouldn't say that. We do have some students in isolation on campus in very specific locations that are that were predetermined, but we don't have any students in isolation with shared spaces with other students. But no, absolutely not. A student who's in quarantine shouldn't be leaving their room even to get meals. We'll deliver. No worries, Dave. We'll deliver food to them. And if they haven't had food delivered, absolutely, make sure that they can certainly get in touch with their RA. They can call university police. We will absolutely make sure that that student gets food delivered to them, and that's our goal.
And Dave, to that point, or to everyone at that point, I can't always be of much help in the moment, but you can always let me know, and I'll do what I can in the moment. And like in this particular case, send me the details, and I'll also follow up and make sure that it's not a challenge in the future.
Thank you. I appreciate that.
Yeah, we're delivering meals across the campus with a host of volunteers, and dining services is staying on top of it. But that's, again, if there's an error, we certainly want to know about it so we can correct it and get a student some meals.
So the only 4 individuals that were raising their hands before I made that last call for Res Life were Tim, and then Kate, and then Braden, and then Jack. The other questions we'll still get to, but we'll probably, in the interest of time, move along from the Res Life topic. So Tim, Kate, Braden, Jack.
So I had two questions. The first one is just really quick. You mentioned before that you were only moving people if they had a roommate. If they were contact traced by the time that Res Life reaches out to them to move them, wouldn't their roommate have already been potentially exposed? And then my second question is just kind of a lot of the stuff that you were mentioning in terms of the protocol seems to be coming from a very idealistic view of the situation, where if students follow the 6 feet apart and wear a mask and are washing their hands and are maintaining social distance and all of this stuff, then it should work in theory. But I mean, just from my personal experience, it does not seem like there's always that idealistic situation that's actually occurring. So for example, in my building, there are several students right now who were supposed to be quarantining in place and have currently left the building to go and quarantine at home. And there are still meals being delivered to their rooms, and there are still laundry bags. So my concern there would be if these people were able to just kind of up and leave, and Residence Life and Housing didn't even know about that, how could you say that they're keeping an efficient eye on making sure that everyone is following these protocols?
Yeah, thanks, Tim. I mean, students can, I forgot to mention that, students can decline the provided university options, or they can, if it's on campus, they can decline that and choose to go to their permanent resident or elsewhere under the care of a family member. So I can't speak, of course, to the particular situation there, but we are certainly seeing in our systems and communication with students that in some situations, students will start their quarantine on campus, and as they are able to make arrangements with their family, will choose to decline that and go again elsewhere under the care of a family member. We've really seen that realistically all year long. Sometimes students are able to make those arrangements really quickly. Sometimes it might take a day or two for students to make those, but that does go through an approval process for students that we review those requests and approve their location to where they're going to be quarantining or isolating. And so we are putting those under a pretty strict review to make sure that, again, they're going somewhere safe and that that's approved, and we know where they're going. I can't say we probably need to catch up our systems on collecting trash bags and laundry and making sure food's not being delivered there still. But certainly, if you're aware of that, let us know. I'm happy to take those kind of things, and we'll do that research, because ultimately we want to know that students are safe and where they are and that they're cared for.
And Tim, just to answer, I'm going to answer just a little more broadly about kind of the first piece of your question or your statement, which is, listen, you're right. This isn't idealistic. There's no doubt about that. The only way we are going to get through this, I mean, raise your hand if you're exhausted. Everybody's hand's going to go up because we are all exhausted. Dave might, I know you're exhausted. You know, and yet that's where we have to double down on, you know, we know the RAs are exhausted. If somebody knows that somebody's left, let us know, you know, let Res Life know, put a report in. You know, again, if you know something's going on off campus, give more detailed information. You know, if you know somebody needs help, let us know. I always go back to, you know, the first thing you all went through as first year students was bystander training. You know, this is where the training needs to kick in. And, you know, I always have those people say to me, well, we're not going to tell on each other. We're not going to rat other people out. Well, you know, holding each other accountable and looking out for each other is what's going to help us get through that. That's me getting off my soapbox now.
Kate, then Braden, then Jack.
Yeah. First of all, I just wanted to thank you for being here, Dr. Clifford. I know that this is a very stressful time and there's a lot of anxieties. With that said, I do have 2 questions. So the first one, we have like one of these quarantined people in our hallway. And I was actually wondering about why you chose like the signage that you did, just because I like basically it says like restricted access, essential personnel only. But it doesn't actually say that there's like a COVID, like somebody who's been exposed to COVID. So my friends who are on that end of the hallway sharing that bathroom don't know, like they didn't know essentially until I told them this was going on, that they had somebody COVID positive on our hall. And then the second question, hopefully you can keep track, sorry, I know they're a little long-winded. Pretty much my entire hall has COVID, including as of about 20 minutes ago, my roommate and presumably me. So do you take that into account, like in terms of like putting like somebody who's been exposed on the hall, especially because like my hall is like 13 people and I'm pretty sure 9-ish of us have it now. So like, is that something you would take into account too?
I might need to dig a little bit more into the second question to understand it better. The first question, as far as the signage, does have to go back to you know, students' medical information, and we just really can't share that. And so by putting, I know we might you might say, well, you have a sign that I could reasonably interpret to mean that a student has COVID, but we can't have a sign on a student's door where, again, like students know who lives there. They have, you know, frequently have a door decoration that indicates their name or so on and so forth, that has medical information on it. So that one is relatively easy. But at the same time, we can put a sign there that, and that's really to make sure that if facilities and campus services were coming to perform a work order or clean the room or something like that, that they're aware and make sure that they're, if they need to perform work there, that they have the appropriate PPE. And so, Kate, I might need to learn a little bit more about the second part of your question to try and understand that. Wasn't quite following. I apologize.
Yeah. So basically, I guess like my hallway just has like a lot of community spread from like the best that I can tell, just because the vast majority of us have COVID on my hallway. So I was just kind of wondering if you took into account like which hallways have like a particular risk of COVID, I guess, like, or a particular like people who have it, in like determining what rooms to place people in, or do you just kind of place people in like whatever empty rooms you can find?
Yeah, that's a good point. We are we are certainly tracking or monitoring, I should say, not tracking. We're trying to learn what we can from how residential buildings, how the environment could, what we can learn about COVID spread in particular environments. You know, suite style buildings, apartment buildings, traditional hall style buildings, to help us determine that. It does not factor into where we place a student for quarantine and isolation, because again, or I should say for quarantine, if a student is quarantining, then and they're in a vacant room and they're given very specific instructions about what they should do there, that can be a safe environment. I do want to reiterate, and I know I've been living in this far too long, and I feel like a deputized public health expert at times, which is not a title I desired to have. So the language can be really hard to navigate, for sure, and there's a lot of really specific terminology. But I do want to make sure, again, if you have symptoms of COVID, or you go off campus and get a test, or you get one in the mail or things like that, and it comes back positive, how critically important it is to report that to the student health service, to, again, like Tim said, really tapping into that bystanderism to really support the health and welfare of our overall community. And that might mean to stay at a hotel. I understand that, but it really does protect the overall health of the community.
Okay, Braden and then Jack.
Hi again, D. Clifford. So just to kind of follow up, you've mentioned repeatedly that we would only contract trace people and move them out of their rooms if they had a roommate. But I've heard multiple instances of people that I know personally where both them and their roommate have been moved out to other dorms around campus. So now both people are going out into communities like we've talked about before. And also I know multiple people that have received email and verbal correspondence saying that even though they have been contact traced and now are being quarantined, they are allowed to go out of their rooms to the Pit or Benson and get food and bring it back. And they have the emails to prove that.
I'm happy to look at that information if you'd like to talk offline. I think that's, and I don't come at that from a, again, sort of a conduct lens. I'm interested, again, if there are breakdowns in our system, I'm interested in fixing those. So if you want to follow up offline, I think I'm happy to do that.
Jack.
Hi, Dean Clifford. So lots of my constituents and myself are at the Best Western right now. And sorry, but there's windows on the outside of the building that you can go out. But we tried to open our windows yesterday and somebody came out from down below and screamed at us and said, like, you have to close your windows or like, we're going to come up and close them for you. Is there like a rhyme or reason to that? And then my second question is, like, with how chaotic this week has been, has this been like, how planned are you guys for the future, or are you just like playing it by ear, like for the next couple weeks?
Yeah, that's two great questions. On the first, the windows. So we are not, contrary to popular belief, maybe we do not own the hotels. They are leased. And so the property is, it certainly belongs to the hotel. So we're following, it's their property, and we want to make sure that we take good care of it. And so again, in terms of the windows, those do need to be closed, per the hotel's policies. As far as the future plans, again, we put a lot of these contingency plans in place in the summer. Those plans are being tested. I will certainly say that. And again, part of that has been the plan to announce additional hotel space was not something we had accounted for, but we are trying to meet the challenges that are in front of us to keep in-person classes, to keep everybody here and safe, and get us to May in the same way that we started January in person. And so absolutely we're having to adjust our plans, but we do have, again, that long arc, especially the framework for decision making, that really is informed by data, that is where experts in public health and infectious disease are consulted, and then university leadership can make a decision with those things in mind, to keep us, again, to really keep the academic core mission of the institution intact.
Thank you, Dean Clifford, for your time. I'm going to move us along from Res Life in the discussion portion, but if you still have Res Life questions, you can send them in the chat and we will consolidate all of those after the fact and try to get more information on those questions if they haven't been answered. But Dean Clifford, you're free to stay as long as you want, but also I know we've held you with questions for 40 minutes.
Allie, can we get a mold question in tonight?
And absolutely.
Johnson mold question, throw me back to my freshman year.
I'm happy to talk about that, but actually that's one of the things I'd love to talk about other than COVID, but I'd love being here. Unfortunately, my children have just arrived, so it's time for me to cook dinner.
Well, thank you so much for your time, especially so late on a weeknight. We appreciate it.
Good. Thank you.
Thanks, Matt.
Bye, y'all.
So everyone, we are going to continue on with doing constituent concerns on the front end of this. Emma, if you had a question you still wanted to ask, your hand's been raised for a while now. So if you would like to, now's a good time, or otherwise we can move along.
Yeah, I can ask it. Sorry, can you hear me? Sometimes things don't work with my AirPods in. Okay. I was just gonna add on to something that I think Braden mentioned earlier. I've had a few friends go into quarantine and they actually haven't gotten their food delivered to them. So they've literally at some points had to go to the pit if no one else in their suite's around with COVID. And that's happened to a few girls in my dorm too. So I know it's just like a fluke in the system and that like he was saying, I'd probably have to talk to him separately about it, but it definitely is a concern because, you know, kids with COVID are walking around campus and such because they can't get food delivered to themselves. So
Emma, you're right. Listen, like Matt said, we're, constantly modifying the systems, but like every system, if there's a breakdown, we need to know. Feel free to, I'm going to unburden Dean Clifford just a little bit. Send me that information and I can follow up on it. A, to make sure those students are taken care of, and B, if there's a breakdown in the system, we can figure out where that is.
Okay, that sounds good. Thank you.
I'm going to run through some of the other questions that we've received from the constituent concern form that weren't related to Rest Life specifically. I believe Braden and Megan are going to help me do that, and then continue raising your hands now if you have other constituent concerns.
And any of the unanswered Res Life concerns we'll take back to Res Life.
Right. So something that has been asked up to this point is there a breakdown that exists of people who have positive tests versus asymptomatic positive tests versus contact tracing? Is that a number that exists somewhere that is public?
I cannot speak to whether that is public. I mean, obviously it's a constantly shifting number as our contact tracers work. But obviously our COVID team is working with the most accurate data that they can. But it is shifting moment by moment as they contact trace as new cases come in.
And then second kind of interesting other question on the side is, if you have a romantic partner with Valentine's Day coming up, are you going to get in trouble for doing something with your partner?
I'm gonna have a little fun with this one. Of course, that's not our goal here. This is one of the reasons we have a COVID amnesty policy. So if you want to say hi to your special someone, I think that's going to be okay. Let's, if it comes to an investigation, we will work through that. I promise you all.
Megan, did you have a question you were going to ask from the constituent concern form, and then Braden, and then Ethan?
Yeah, so I'm just going to read it straight off of it because I don't want to mess it up. But basically the question is surrounding dining and privacy. So the question is, are we being photographed or held in violation for campus guidelines for outdoor dining with immediate household, i.e. at Campus Gas? And can we go to restaurants? So basically that question is, are we going to be penalized for going to somewhere like Campus Gas, although it's Campus Gas with our immediate household and it is outside? And then the question is also, can we go to restaurants?
Listen, I trust me when I say we're not sitting around taking pictures. But I will tell you that, when reports have come in, especially, we know Campus Gas is a challenge. Especially if you're off-campus students, I would tell you to use good sense, less about the conduct policy and more about keeping each other safe. And when we hear about, for example, we've heard groups are going to certain places. Of course, we're going to look into that as organizations. Sometimes we find out that's individuals. So, again, off-campus students, we want you to use good sense. Victoria. No, I think I was being a little tongue-in-cheek with that, Victoria. If the conduct office gets some sort of case and it's two students who are romantically, I can't speak to what the final answer to that will be, but that's something I'm sure the conduct office will take into account, especially if those two students have remained in close contact with each other.
I'll just add to that, as far as the restaurant piece and dining out, the other concern around that is just with contact tracing And if someone was potentially finds out after they leave the restaurant that they were exposed earlier through contact tracing, we're trying to prevent community spread into our surrounding area as well. And so that's part of the not dining out request.
Okay, thank you. And I'm just going off of the concern, just making sure I've addressed everything. It also sounds like a bit of like this constituents like uneasiness was basically the talk about people photographing individuals at Campus Gas, basically saying, let's say I were to be there with my immediate household, like basically ensuring that they would be not held. Like, I think people are nervous about getting in trouble for things like dining with their immediate household outside. So I just wanted to,
again, Megan, I can't speak to whether or not, like, again, we're not out taking pictures, but if we do get pictures, that is something that will be looked into. I can tell you my immediate concern is far more from a organizational conduct perspective, and less individual students. But like Amy said, I would encourage you all to think about, and when you talk to this constituent, especially if they're an individual or with their house, my advice would be worry less about dining out because of getting in trouble, and more about dining out because of community spread. I really miss going out. I've been in the house with my 5-year-old for a year now. And my wife and I could use a good date night, but we're not doing it right now because we know it's just not worth the risk. So that's how I would tell students, unless they're going out as organizations knowingly, to worry less about being photographed and going out, and more about not going out and avoiding community spread.
okay, thank you both so much.
Absolutely.
Braden and Ethan, could you guys just read off those two other constituent concerns?
Yeah, so one of the main constituent concerns has been, why is ZSR in the gym closed? A lot of people have been citing mental health as a reason. That was one of the last places they could go, freshmen in particular, because many of them are living alone and they feel very isolated. And a lot of people feel safe in those spaces, so they didn't really understand why they were chosen to be closed.
It's a great question, Braden, and I'm going to throw Benson in there as well. As I was thinking through it, the best way to describe it, I mean, I'm old, I like an English muffin. There's just too many nooks and crannies. And it's just far too difficult to monitor and keep those spaces clean as quickly and consistently as we like. Trust me when I say, having been in those meetings, and Amy overseeing Benson operations, we intensely dislike taking those spaces down because we understand the importance of them, not just to students, but to faculty and staff as well. Frankly, I miss you all in Benson, but we've got to think through, how those large unmonitored spaces could potentially affect community spread. So trust me when I say that is one that's been scrutinized diligently, because it is not a decision we take lightly.
Yeah, I would agree with everything Tim said. Cleaning protocols are a big part of that. If you think about our campus spread right now, the cleaning staff, we've got to prioritize where we can clean efficiently and effectively. And the most important places are going to be the residence halls and classrooms. So it came down to prioritization. We have wrestled with it. We have reevaluated it to see if we could do it. And again, that decision's made in partnership with public health guidance as well. And so I just want to remind us that when we make these decisions, they're not made lightly. And it is with public health guidance in the forefront. And I know that's hard. I'll also just say that while it's not the same and during the day, please remember that Manchester, the fire pits are on at night. It's outside. It's definitely a safer space. So we are trying to provide some monitored, safe outside spaces at least. And I know that doesn't help a whole lot, but.
Thank you both. Ethan, did you want to read off that constituent concern?
I think I only had one constituent concern that I read earlier. But I did have another question from other constituents. This may not be a question that anyone can answer, but I at least wanted to get it on the record. I know several of my fellow RAs have reported having to deliver food to those in quarantine. I don't know if that's because of a breakdown in the system or where that's coming from, but I know several RAs have reported having to do that. So I'm not sure if that question could be passed up the food chain or whether someone could answer that directly, but I did want to put that on the record.
Yeah, Ethan, I mean, thank you. Of course, we'll get it answered. We'll send it right to Dean Clifford. And again, knowing he has more meetings coming up with the RAs, absolutely, we'll turn that over to him.
Yeah, I was just going to add to that. I know there's an RA meeting this evening that Dean Clifford has with them. So
let's do Aria, Jackson, then Caroline Dixon. And then if anyone else has questions they'd like to ask during this section of Senate, please just raise your hands now so I can get an accurate picture of how many we have left.
Okay, hi. So I have a concern from the constituent. I don't know a lot about this, so I don't know how much of this is like true or whatever, but she was just saying that she has a problem with like transportation, and there isn't a shuttle that goes to like a Target or a nearby grocery store, and people still need like necessities, groceries, like basic stuff, that kind of thing, and they're not allowing zip cars anymore. And then she said the only option left is Uber, and she said that she's had bad experience with Uber, like had a knife pulled out and stuff like that. So is there a shuttle that goes to Target or not? And if not, is there a way we can make that happen?
I will look into the shuttle. I can tell you the Zip car is down during the day. We believe they were reevaluating their cleaning protocols. So we're going to follow up onto that one as well as to when that's going to be back online.
Can I add something about the shuttles? As of last, like fall, November-ish, Parking and Transport, like Mr. Chris and Mr. Campbell, I think the premise of everything was we're not going to do that because of all of the risks that y'all very much know of. And I know that they were going to reevaluate this semester, if I'm not mistaken. However, this semester is how it is. So based off of past conversations I've had, unfortunately, that is probably going to be the case because of increased numbers that we won't have a shuttle. But I'll certainly bring it up when I'll bring it up to Parking and Transport still. But that's just from what I've heard, that's very likely how it'll stay. And if anyone has different information, please talk about it because mine's a little bit dated.
I'll just add
that's
to
totally.
that.
Oh,
Sorry, go ahead.
No, you can no, go ahead. Go ahead.
I agree with that. And part of it is, again, having to prioritize the shuttles that we run because of reduced capacities on the shuttles. We've had to put more of our shuttles into rotation to go back and forth to Wake downtown and our other routes. And so again, it's about prioritizing using them for academics and that sort of thing. I can't speak to the weekend stuff, but I know that we can absolutely look into that and see if there's anything that can be done or the reasoning behind it. And again, same thing comes into play, cleaning protocols and trying to turn them around fast enough.
Thank you, Jackson. And then I believe I said Caroline Dixon.
Yeah, so I'd just like to share a concern that's been felt particularly hard by a lot of the freshmen here on campus, and that is that, you know, given the fact that the majority of freshmen on campus have been given singles, these new restrictions have hit us particularly hard, myself included. You know, I mean, in general, we're feeling incredibly isolated, and there really is not, like, myself and many of my constituents and just fellow freshmen have pretty much not left the room since these new restrictions have gone in. And, like, you know, we can't have guests in our room, and the only place we can't even really, it's been cold and rainy, so we like can't go get food in the pit or anything like that. And so I don't know, I would just like to share that, you know, a lot of the freshmen are feeling particularly isolated, and I was just wondering if there's anything we can do about that. I mean, I know that's not really a specific question, and more so, like, how long do we expect these restrictions to stay in place? Because I'm just not sure a lot of freshmen have just decided to up and leave because they just can't bear to stay alone any longer. Yeah, that was just kind of what we're feeling.
Jackson, I appreciate that. I appreciate your sharing that. And I hear you. One of the things that I would love to do is talk more with student government, whether it's student government, specifically the SOC, whether it's first year students, whether it's student orgs, what can we be doing in the next few weeks? And listen, I know nobody wants to sit on another Zoom call or do another virtual event or program, but trust me when I say, and I look at Amy Cha-Cha and the work we put in on the Manchester fire pits and the excitement we had there, and knowing we're going to have to pivot again for a few weeks, and we're hoping it's just a few weeks. I think we would love to talk about what are ways to create engagement opportunities, especially for our first year students over the few weeks. Allie, now would be a great time. Would you like to do the introduction?
Yeah, I was just sending a little message to Tim. We have a new person in the student government Zoom call right now, Ms. Shauna McNeil, and she is joining student engagement and will be working with our committees. So welcome. If you want to say anything, we're really excited that you're joining us.
One, good afternoon or good evening, everybody. I have been listening in intently since about the start of your meeting. I want to commend you on hearing the needs of your constituents and bringing those forward. Obviously, you're going to keep us on our toes, but that's a good thing. I'm looking forward to working with you all. I'm glad that I have Tim and Amy and all the rest of the team to assist as we transition me in. But please, if you need anything from me, I'm happy to listen. I want to learn as much as I can from you. And I'm looking forward to working with you all.
We're excited to have you. Sorry, I just put you on the spot completely. But I kind of blame him for it.
Quite all right.
So it's Tim's fault.
Everything. You all blame me for everything. In all seriousness, I've been talking for months now about the fact that we're finally going to be staffed back up. And we are finally staffed back up as of Monday, with Shauna joining us, as well as Aaron Parrish, who is our new assistant director working directly with Student Union. So Jackson, back to your question, one of the things that we would like to do is, we can now dedicate more time to figuring out what are different opportunities to engage students. That is a big piece of what Shauna is going to be working on early on. She knows that unfortunately she's not going to have the normal transition and she's going to be thrown right in. And I've known Shauna a lot of years and I'm super excited about that. So I think that is definitely a conversation I'd like to see student government as you are all able with everything going on. To take the lead on.
Jackson, I also hate to answer your question by giving you a job, but expect that you and Kate, as our new COVID liaisons, will be having some conversations about freshmen in quarantine. So congrats, you gave yourself more stuff to do. Caroline Dixon, you can go ahead, and then Nick Dowling, and then Brooke.
Okay, I'll keep it short because Jackson kind of, I think we had very similar concerns and so stuff that's been brought to me. But I think, like Dr. Clifford said, addressing the concerns of students who are sharing bathrooms with, people that have been exposed to COVID, and lots of my friends have gotten the same response through student health, through emails and phone calls, just, wear the mask, stay 6 feet apart, and the transmission's very low, like you have nothing to worry about. And I think from freshmen, that's evoked a lot of frustration because you hear them saying now, okay, wear the mask, stay 6 feet apart, and you'll be fine. But then we've been doing this for months now with the, common rooms closed, even though it's very possible to stay 6 feet apart with a mask. And we can't go to the library. What about 6 feet apart with the mask? So I think, well, I completely understand the necessity of, what we're having to do in the moment. And like everyone said, this isn't ideal. I think maybe trying to formulate a better response to these concerns, because I think they're doing a little bit of the opposite of trying to ease people's minds.
Totally muted.
Yeah.
I'm wondering if this is a good place for PR to work with us in the next week or so, to sit and really focus in on what are the 4 or 5 questions that you all feel the most frustration that we've not given the most cohesive answers, and let's boil that down. Besides student government, social media capabilities, knowing that Dana Hindi is now capably leading student engagement social media responsibilities, we can work to get more word out.
I think that would be a great idea. So thank you, Caroline, for bringing that up. That's really important. I think I said Nick next and then Brooke.
Yeah, so I did get a constituent concern that came in, and it's definitely coming from someone who, like all of us, is feeling, you know, is sort of very concerned about the situation, and they're definitely, you know, have a lot of emotion tied to it, which I think we all do. But, you know, they're sort of wondering from their perspective, you know, when will the university sort of put everything else aside? And, you know, they feel as though it seems like as though the university is putting profit over our safety, and sort of put everything aside and go ahead and move to red, and sort of what it will take to move in sort of into that red stage. And then just going off of that, there was an email that was sent out today from Office of Academic Advising, I believe. And in the email, it addressed questions. And one question was, how will blended and like traditional courses be in an online version? And I think, you know, going through it, it simply stated that there is no way for those classes to be in an online version. So, you know, how might the university even be able to address that and go into a completely online fashion?
Well, Nick, I think you'll almost kind of answer the first question with the second question, in that, you know, one of the reasons that we want to keep, I would say the main reason we want to keep you all in Orange and keep us in Orange is, as much as possible, we value the student contact. We're a residential campus, you know, that's why you all came here. That's why we enjoy this environment. We want to keep you in face-to-face classes. You know, we want to keep you on campus. You know, I can tell you, being in the operations meetings that I am in, and Amy's in a heck of a lot more, not once I heard money come up. And I understand the concern around that. And you know, I get that. I get that perspective. I can just tell you, and I mean, having heard it from the provost directly the other day, our goal is to keep us here because, as you said with the second question, you know, trying to go, we saw it last semester, or last year rather, going from in-person or blended to completely online is difficult. We don't want to do that. And we also know that academic advising and ODOC is working with professors to figure out where they can do that. So obviously we're close. You know, let's all be blunt and honest. We're very close to red. You know, I can't sit here and say it's 5 more cases or 10 more cases, because it's a combination of cases in quarantine and spaces available. But obviously we're on the precipice, which is why right now us working together is so important. But I can tell you it's about keeping students here in person in classes as much as possible.
And I'll just echo what Tim said, in that it's, you know, we're hearing from you right now on this call how hard it is to stay in your room and do those things. And so I think that part of the decision making is first and foremost public health, safety, availability of beds, all those things. But also additionally, like, if we go and do an actual 2-week shutdown, then that's only going to make everything that you're feeling right now worse. At least right now, you can go walk around campus, right? You can stay 6 feet socially distanced with a friend. If the weather permits and it's not raining, you can at least go grab a blanket and a coat and sit on Manchester and get outside time for your well-being. You can still, you know, while we're asking you to really limit it, you can leave campus to get supplies and come back. All of that would cease to exist in some way. And so in many ways, it would make it even harder than it is right now.
Okay, I'm just going to remind everyone that we're going to try to wrap up the section with just those who have their hands currently raised, but I would encourage you, if you have another question, to send it in the chat. Brooke, and then Sarah, and then Gabby, and then Uma.
Hey, thank y'all so much again for coming and talking to us tonight. One of the questions that I have, and it actually just came in from a constituent who's live streaming this, is that it's been mentioned several times about kind of like a fluke or a breakdown in the system with stuff being delivered, like people not getting their food. But how is that considered a fluke or a breakdown when multiple students have seen it happening? I think all of us have heard from constituents already that there's people who aren't getting their food, who are having to go out to Benson and get it themselves. And so then to build off that, if we were to go into red, if the university isn't really doing this effectively with just however many students we have now, how is it supposed to cater to the whole student body?
No, Brooke, that's a great point. I don't believe I don't believe I used the word fluke at any point. If I did, I apologize for clumsy wording. I think
No, that
what we're-
wasn't you. That was Dean Clifford. But
Okay, but even that, Dean Clifford said breakdown, and then I followed that up. We are every time we pivot, a new system's being developed, and we know that, for example, food delivery until it's put in practice, we figure out what's working and what's not. So when I'm saying it's a breakdown, what I'm saying is where it's not working, let us know so we can figure out where isn't it working, why isn't it working. Obviously I can't sit here and give you a good answer as to, I think the 2 or 3 examples that came up, why it broke down. That is just not the area that I work in. But what we can do is, and that's why I'm saying, send me the specific information so we can turn around and get those answers or figure out how to improve it. Because if we do go into red, we're going to have to rely on it even more. This is a rhetorical statement, but this is not a meal delivery system we've ever utilized before. So we've got to figure out where the flaws are so we can fix them.
Sarah, and then Gabby, and then Uma.
I just had a quick clarifying question about the duration of quarantine versus isolation, because I know some people that are in the hotel for quarantine, like exposed but without symptoms or without testing positive, and they were told they only had to stay in the hotel for 10 days initially, and then like the day before their departure, they were told they would have to go back to campus and quarantine for 4 additional days. And so I was wondering if the guidelines have changed in the time they've been in the quarantine, or if they were given misinformation when they got to the hotel.
I can't answer that directly. What I think, what I'm hearing is that their guidance changed. Is that correct? That it was initially 10 and now they're being told 14?
Yes.
Okay. I think Dean Clifford mentioned this earlier. There's a lot of decisions that go into that, whether they develop symptoms, the point at which they were tested also impacts that. And then if they begin to develop symptoms, or if they've been contact traced through other methods as well. And so I think that's something we can follow up on and get clarity. And as Dean Clifford mentioned, there is a communication forthcoming that clarifies a lot of this, the difference between quarantine, isolation, the period of time, and the factors that go into that. And I think he said he is hopeful that that will come out this evening. So more to come, but we will absolutely clarify that. I will also add that because things can change from the time you initially went into quarantine to the time you come out. When I say change, you could become symptomatic and all, that it is, they are putting in the student health portal. It's not going to be real time because we can't answer those questions until you get to the end of your quarantine period. You could develop symptoms the day before you're going to be released. So we can't give you, that date could continually change if you were to become symptomatic at any point during that. Does that make sense?
Yes, but
Go ahead.
I was going to say, if they didn't get symptoms or anything changed, it should remain the same.
It should, but listen, this is where we often default to different students have different experiences, and we can't give consistent answers to why this student occurred to versus this. But Amy hit it broadly, which is when you're tested, how long you're in, what your symptoms are all the way through the end. So, again, I think Dean Clifford answered it as well as he could, knowing that it is both an art and a science, for lack of a better term.
Gabby, and then Uma.
So I got a couple questions from constituents. One mainly being if there was any way that the experts at the university is using in regards to any of these changes with COVID guidelines can give out an official statement, whether it be like a video or some type of document to prove to students that this isn't just university officials saying this, there's actual solid evidence from experts that they're saying this, and this is just what the university is following. Because I think that would also ease the minds of the students as well to see that there's actual backing to this.
We can talk to the steering committee again. Dr. Ohl Dr. Ohl from Wake Baptist is a specialist in this and is a national expert in this. And he joined us on the call the other day, and he is part of the steering committee. So, and he's put out videos before, so we can absolutely reach out and see if we can make that happen.
Okay, and then I also have another concern. It was regarding the housing, I guess, circling back to that. It was why would it be more effective essentially to have someone who was contact traced moved to a single room in another suite instead of having their roommate moved into that suite instead, since they wouldn't have been contact traced?
If it's all right, Gabby, I'm just going to use this as a general statement. If it's all right with the residents' housing questions, we're going to compile them and take those back to Dean Clifford Residence Life, just because he gave he answered the best he could for as long as he he can give much more nuanced, accurate answers than I can, just based on that being his area. So we will take back all of the res life and housing questions and get concise answers.
Perfect, thank you.
Uma, and then Caroline, and then Ethan.
Hi. So I had a few constituents' concern come up, and I think it's an understatement to say that some students have been feeling stress. And while these past few days Wake has imposed a lot of restrictions that felt like a punishment upon the student body for the current trend in COVID, a few students have also felt like, especially those who have been obeying the COVID regulations on campus, feel like there aren't any rewards per se from the school, or any sort of affirmation that Wake Forest is in fact thinking of the well-being, both mental well-being and physical well-being of the students here on campus. So I'm wondering if there are any talks of initiative or campus engagements that abide to the COVID regulations that are currently, I guess, that people are talking about, of organizing here on campus just to boost the morale and spirits of the Wake Forest body. And I know that a few RAs have also expressed their frustrations that a lot of weight has been placed on their shoulders, especially in enforcing regulations on campus without the proper resources that they need in order to carry the burden that are being expected of them to carry out. And specifically about the food deliveries, and they just don't know who to contact if things come up regarding to that. Yeah.
Well, the RA question again, Uma, we know that Dean Clifford's going to be speaking with them tonight. So if it's all right, I'm gonna allow him to have that conversation since he can give them the best answers. In terms of engagement and well-being opportunities, our counseling center, campus rec, well-being are all putting out opportunities. Again, now that we are staffed back up, that has been an immediate pivot for our office. When I say it was one of our first conversations yesterday, because we are trying to, again, we had focused entirely on the fire pit project and providing in-person programs. So now we're quickly shifting to look for online and virtual opportunities as well. One of the things, and Drew and I were texting, knowing how taxed RAs are, one of the things that student engagement is trying to do is figure out, we know we have safety plans even for online and event plans for online activities. Right now, we're trying to figure out what online activities are out there that you all may be interested in. Shauna, I'm going to put you on the spot again, and I apologize for that, but you're also kind of used to that. Can you just talk to a little bit about the conversations we were having yesterday? Because again, we talked about this a little bit last semester. This is where I would love where you all have capacity to help us figure out what are opportunities or what are things we should look to take advantage of.
Sure, Tim. So we have, there's myself, and then we have another staff member, Erin Parrish, who started just yesterday. And so we're already looking at ways that we can engage you all as students with programming. I know no one wants to be virtual. I get it. But in the meantime, we're trying to kind of fill the gap in what we hope will be a very temporary time period that we're under these additional restrictions. So we are looking at putting together some programming that we will partner with Residence Life and Housing on, like some family feuds that are done with teams per residence hall, and we'll do it bracket style. We're also, I don't know how many of you have ever heard of Oxcord Wars, where you kind of get your playlist together based on different genres or a theme. And so we're looking at how to pull that together. And so we're trying to move as quickly as possible. Our goal is to really have something that may be introduced to the campus community by next week. That students can participate in, that's gonna give them some sense of relief and some sense of connection to their peers that they don't get to see as often as they would like. I recognize that this is really, really difficult and frustrating, but we're trying to move as quickly as possible. And it just is, we're in a season of change. And so just as quickly as we're moving from a programming standpoint, things are changing related to COVID just as quickly, if not faster. So I will ask that if any of you have some ideas of things that maybe you heard about happening at another campus that you would like to see here, or something that you know we've done in person, but you want to figure out how we could possibly do it virtually, shoot me an email. My email address is McNeils, MC, capital N, MCNEILS @wfu.edu. We want your input. We've got some good ideas. I can tell you that Erin Parrish and I did a brain dump today and looked through and kind of just pushed as many things as we could think out that'll hopefully get us through. I'm crossing my fingers, no more than 30 days. That we'll have to do some virtual programming. But if there's something that you would like to see, we want to push that to the forefront as well. Does that help, Tim?
I want to cry. I'm so excited to have Shauna and Erin here and to be fully staffed up. One of the things that we know we struggled with as a campus last semester was finding virtual opportunities that students were excited about. We also know that this is a national problem, not just a Wake Forest problem. But again, I am by no means putting this burden on student government, but knowing that we now have support to conceptualize programs that you all think would be more effective than really just us kind of spitballing last semester. Please provide us those suggestions, and where you are passionate, please jump in and help us. Allie, just an FYI, as much as I don't want to with everything going on, we still have, well, I don't say I don't want to, we have the student trustee.
I was about to say.
So, I mean, I want student government to keep going. I just want to let you all know I can go for about another 10 minutes and then I've got to jump on the student trustee information session call. So we have, I mean, trust me when I say, we will work to get every question answered. We haven't answered yet. If you have questions, if you want to put them in the chat, we know that Carolyn will pull them and provide them to us. And I'm not trying to cut Q&A off. I just know, and I also need to be fair, as excellent as Shauna has been, I can't expect her to know anything in 2 days based on the questions that we're getting. And, Amy, I have to be fair to Amy as well, based on her workload. But keep going for a few more minutes if you want.
Yeah, so I was just about to introduce a caveat. We have 2 more people. I would just ask Caroline and Ethan if there are things that we have not spoken yet about. Please feel free to ask them in that order, Caroline, then Ethan. We do very, very briefly need to run through a couple just reports from a few officers and cabinet committees, particularly PR, with stuff going on this week. So we'd really like to do a quick run through of that. So if you have things that we haven't already discussed, Caroline and then Ethan, otherwise we'll move on.
Given that we've had a lot of questions tonight, specifically about the quarantine in place policy, and it seems like there's just a general confusion about what that entails and how students can get access to simple things like meals, has the university considered sending out an email that specifically outlines what quarantine in place means and how students can get access to meals and things like that, just to be sent to the whole student body? Because I know that it's they've been sending emails to people who are being relocated through the quarantine in place policy, but it might help alleviate some of the concerns of other students who haven't been contacted to quarantine or who have students moving into their dorms to know more fully what that entails and why those students are being asked to relocate.
Caroline, great. Allie, go ahead.
I was just gonna say, this is a conversation that I know I had today with Ms. Life and some other administrators, and I think Miles just sent something in the chat about it. I believe something went out this afternoon though, and that if it didn't, it's coming out shortly with kind of that outline of the quarantine in place thing.
That's what I was going to say. I am 95% sure that's the case. If there's still confusion, again, I'm wondering, Allie, if PR would like to take on, let's sit with student government, go through the constituent concerns and where there's still confusion. What are the top, I would say right now, what are the top 5, points that really need to be clarified? I'm so excited the committees actually have somebody to help them now.
Hey, thank you, Tim.
Yeah, so there should be an update tonight, I believe, or early tomorrow, according to what I've been told.
And then Ethan.
Yeah, I really just have a question, I suppose, on behalf of a lot of the families and parents right now who are feeling pretty frustrated, frankly, with the amount of tuition that we're having to pay for what's quickly becoming a sort of Zoomiversity for a lot of students. And I've had the opportunity to work with a lot of families in the past couple of weeks who have really gone into debt. And I think, frankly, they are frustrated that, we have the ZSR library closed, the Wellbeing Center is closed. It seems like outlets for genuine engagement with the community are increasingly sparse and limited. And so I suppose the question that a lot of families are asking right now is there a point, if the university were to close, that the university would promise to reduce tuition rates or provide refunds to students and their families?
So Ethan, my quick answer is going to be, I'll take that back, because I can't sit here and possibly give you an answer to a very good and very fair question. I can tell you that, I won't speak to the financial piece, but I will speak to the fact that, I sit here and Amy sits here and we are just as tired and frustrated for as many different reasons. And everything we're doing right now is with safety in mind first. Of course, the financial piece is something that's going to have to be addressed at some point in some way, shape, or form, depending on where we're at. But I am definitely not the person who even begins to answer that question, but it is something we'll bring back to make sure it remains on the minds of those who do.
I'll just add to that too, that there is a university disruption policy. That's not to say that it, would or would not be revisited, but there is actually a policy that outlines some of that is available on the Our Way Forward website.
Thank you. That's really helpful. If you continue to have other questions, put those in the chat, and I think Caroline can pull those before she closes it. Or you can definitely feel free to send those via email to myself, a member of exec, or Tim, or the relevant committee, and in some way, shape, or form, we'll get the information to where it needs to go. Very briefly, I'm going to call on each of the executive members, Tim, and then each of the committees to see if they have anything additional they need to report just for the upcoming week. I would ask you to keep it to only things that are time sensitive. Anything that can wait till next week, let's just try to do that. So with that, Miles, do you have anything to report?
I ain't got much, but just thank you all for your concerns and questions back. We'll definitely facilitate those up, but definitely want to say to the RAs, I love you. Keep doing the hard work. You guys are doing a great job. Thank you. Most importantly, to the co-chairs, you guys are doing a great job too of getting that information out there for students and senators as well. So just continue to keep doing the hard work, and I appreciate all the things that you guys are doing. So just keep it up. Thank you.
Any questions for Miles? Okay, for my report, the only thing that's pressing is that I met with the new director of the Title IX office, Aisha Cassius. She's going to come speak with us at some point this semester, but I just really want to emphasize that there are resources available if anyone that you know, or you in particular, has had any kind of situation where you feel like you might need access to Title IX or Safe Office resources. Those are still available. Title IX deals with discrimination for gender, sexual violence, and then also for disability services. And then Safe Office is a confidential resource. So we will be having Director Cassius join us at some point, but just know that those resources still exist and are available. And if your friends need them, they're available as well. Any questions on that? Victoria?
Hi, all I have to say is we have budget presentations going on this week and the next 2 weeks, so.
Questions? Caroline?
The only thing I have is just that I'm on the COVID-19 Student Compact Committee, so feel free to reach out if you have any questions. And thanks so much for a definitely important discussion tonight.
Questions for Caroline? Drew?
Just real quick, if you're looking for something to do, an extracurricular, we have a bunch of table tents and posters we still need to hang up this week. So just shoot me a message and I will get you supplies to do it socially distant by yourself or with a pair. Thanks.
Questions for Drew? Our lovely advisor, Tim Wilkinson, 3 minutes before he has to leave.
And Shauna, and co-advisor Shauna McNeil. I need to get
co-advisor Shauna McNeil. Sorry, again, Tim's fault. I'm just going to say that.
So just very quickly, listen, I'm going to think positively in that we're going to be through this. Don't forget that event planning for the semester is still occurring. Student activity fee dollars are still there. So, you know, we've had students already who have started reaching back out because we also want to be in a place where as we come through this, we're able to pivot back to in-person programming. You know, we put far too much work into that to let it go. And also remember, as you start to think about ideas and as you start to help us figure out engagement ideas, the dollars are there with the student activity fee. And Amy sits on the student activity fee as an ex officio. Shauna now sits on the student activity fee. I co-chair the student activity fee committee. Those dollars can be used for whatever type of virtual programs and or incentives. It's far better when it comes from y'all. You know what you think will inspire students right now, and we will help expedite that. So please take us up on that.
Questions for the Office of Student Engagement? Tim et al.
Shauna, I don't want to assume you have an update, Shauna, but any updates, Shauna?
No, not yet. We are planning some meetings later this week to talk through the partnerships that we are working on. If there are some folks, I heard Miles mention there are some RAs in the group. I would love to pick your brain because I think you all would be able to give us the best insight on what your residents could use or what may be of interest to them. So if you all would just reach out to me, that would be awesome. And if there are maybe 2 or 3 more that maybe have an affinity or foodies or have an affinity to eating on campus, we're talking about possibly doing some other bracket things that may lead to a type of food for the week in various areas. And I just wanted to get some student interaction and feedback from you all to see if that's something worth pursuing.
Thank you. Sorry about that.
No, it's all right.
For any of those pieces of information from either Ms. McNeil or Tim. Okay, I promised I'd let you go before 8:30, Tim. I just didn't say how long before.
Thank you all.
Those who are RAs or need to go to that trustee meeting, you can feel free to hop off when you need to. Don't feel like you need to message me about that. But academic, any report?
I'm going to leave. Sorry, if I could just interrupt. Thank you for having me tonight.
Yes, thank you.
Compile the information, but please don't hesitate to reach out to me either if anyone needs anything or has any questions. Have a good night. Thank you for all you're doing.
All right, so tomorrow, Ava and I have our meeting with Office of the Dean of the College. So any of these academic concerns, particularly ones related to COVID, will be brought up there. So if you have any, please text them to either Ava or myself or email them. And that's about it for this week.
Questions for academic? If there's anyone still watching the live stream and you asked a question about something academic related that was not asked live because it's going to that meeting tomorrow. We will move on then to campus life.
Nothing new to report, just planning mental health week.
Questions for campus life?
Actually, I don't know if this is for campus life. It's a nice change of pace of a question, but someone asked me if I think the new place in Benson is called like Bento, next to Chick-fil-A. They said there's no Old Golds there. They were wondering if that could be looked into.
I think that's physical planning.
Yeah, it's like I have a meeting with Dr. Wise on Monday, so I'll ask that then.
Perfect. Thank you.
Awesome. Diversity and inclusion.
There's nothing to report.
Questions for diversity and inclusion? Judiciary.
Not much to report this week, but I will just note that we're working on the Canvas course still, and we're hoping to leverage that as a tool to combat rising cases in COVID. So more to come on that. And one other note, because I mentioned it last week, but the custodial appreciation program is on hold temporarily. So thanks.
Questions for judiciary? All right. Physical planning.
Yeah, nothing to report other than we have a meeting with Mr. Wise. So if anyone else has any concerns that they want, just let me know before Monday. Thanks.
Questions for physical planning? Public relations.
Thank y'all so much for all the work you've done so far this week, reposting our graphics. Just continue to do that for a chance to win gift cards. Thank you.
Questions for PR? Okay, and then lastly, SOC.
Nothing to report.
Questions for SOC? All right, thank you everybody. I'm kind of impressed with myself for doing this off the top of my head without a PowerPoint. Pat my own back there. But thank you everyone in all seriousness for a really great conversation. I know this isn't always easy or fun, and I know it's stressful, but please remember to take time for yourself if you need it, as you need it. You guys are doing really great work. I am really happy to be seeing all your messages in those group chats and to be seeing you so willing to help our community. Remember, your mental health and your physical well-being are really important. We see everything that you're doing. I thank you. I know Miles has thanked you like 3 times already this meeting. I know the rest of Exec thanks you, and I know our community thanks you, even if you're not hearing that. So thank you, everyone. Welcome, Ms. McNeil, to student government. We're really excited to have you here. You're good to go. But have a great week. Everyone stay safe.
Thanks, Allie.
Thank you.
Thanks.
Thank you.
Thank you.
Allie.